So for women who have ovarian cancer, there have been multiple studies that have looked at who takes care of women with ovarian cancer. And multiple studies have shown if the surgery is done by somebody who's trained to do this kind of surgery, then patients will have a higher chance of cure. They will have a higher chance of prolonged remission, even in cases of advanced disease. And even in cases of advanced disease, they have a higher chance of cure. So it's very, very important for women with ovarian cancer to get themselves to the right doctor. And women may not know this. They may go to their primary care physician. They may go to their OBGYN doctor who delivers babies, who may or may not be able to do a hysterectomy, and they may think that they're in the right place. But what they don't know is there is a whole field that specializes in taking care of women with gynecologic cancers and especially ovarian cancers. That's one of my areas of expertise, and we have demonstrated that if you have the appropriate surgical training, which GYN oncologists have, that you can give patients a better chance of long-term survival, a better result with the surgery, and a higher chance of cure. Now, specifically with the surgery, what women need to understand is that many studies have been done that have looked at, okay, so how is one woman going to do better than another woman? What is the prognosis of a woman with ovarian cancer? And really, there's only a handful of things that determine whether somebody has a good outcome or bad outcome, or not as good of an outcome with ovarian cancer. One is how far advanced the cancer is. It is true, the more advanced the cancer is at the time of diagnosis, the less likely that they're going to be cured. It's not impossible, but the less likely. There are some other factors like how old the patient is. So if the patient is older, they tend to not do as well as somebody who is younger. Other things like if there's cancerous fluid in the belly, that has a prognosis. But all those things are not determined by the patient or her doctor. There's only two things that are very, very important regarding whether a patient with ovarian cancer is going to do better, whether one's going to do better than the other. And that is, at the time of the surgery, is the appropriate, extensive, proactive surgery done? And if it's done, is it done well? That's the one thing that we GYN oncologists and surgeons have an impact on. And the other one is the type of chemotherapy that's given. If you do the appropriate surgery and give the appropriate chemotherapy, women with ovarian cancer will have the best outcomes.